We need to talk about dying because it affects us all. And when somebody dies, the people they leave behind are left with that memory forever and that experience. And we have lots of choices that can affect how we die. And people assume they're all negative, awful choices, but actually a lot of the decisions people make and the knowledge they have can really change a difficult time into a time of coming together, of not happiness is the wrong word, but actually a time when people can come together as a family and help each other and look out for each other. It can move by planning and talking about dying. We can take something that feels very scary back into our own, back and own it. But you can only do that if you know about it and you can talk openly about it. I'm not sure there really is a taboo. I think we talk about death a lot, but people talk about it in sideways ways. They use euphemisms, or they focus on awful deaths. We see death in the media, death on TV. It's always, or pretty much always, unnatural death. And actually, sometimes that's maybe safer because it's more of a distance, so you can't really imagine it happen to you. But actually, normal, natural death is calm, quiet, peaceful. And if we knew that, we might be less scared. If we knew that, we might actually be able to talk about it and plan for it. We all plan in different ways. So some people don't leave their lives not planning at all, and they're never going to suddenly start planning for their death. But for most people, when they think about planning in advance, they do think about their finances, and finances is very important. And nobody would want the people they love to be left without access to funds or to be unable to pay for a funeral. But also would be things like, well, actually, if I got really ill and I wasn't able to say what I wanted, wouldn't it be really good if the people around me knew what I would have wanted? Or maybe some of those conversations actually when I'm really sick might be really stressful. Wouldn't it be better to have them when I'm not so unwell? But also you can plan about how your funeral might be, or what last holiday you might want. And people have I know some people who are very big music fans, and actually the wrong song at their funeral makes them feel very, very uncomfortable. So it might be something as simple as saying, you know what, this is what I'd like played. But there's lots of different things you can think about. Organ donation is important, and obviously it can save a lot of people's lives. But the reality is, once you donate your organs, you don't know what's happening. You're dead. I think for a lot of people, the thing they worry about, the thing they dread is that time leading up to dying, and actually what that might be like. And I think if you can have a conversation with your family about what your values are, what would be important to you, that can be of an inordinate benefit. So maybe, if I actually couldn't say if I wanted to be at home or in hospital when I died, actually, I'd really like to be at home. So people can start thinking about things. And some of these conversations depend on where you are in your life journey, in your cycle of life, really. So when you're younger, actually thinking about a normal, natural death might be less relevant. You might actually be more likely to think about your organ donation. But as you get older and things start happening, actually there are little signals that maybe you start to get more unwell, or you start then think actually what's likely to happen, and start to think about what your values are really. I think there are lots of different triggers. Often it's life events. So maybe when someone moves into a new home, whether that's rented or whether that's bought, they might start to think, okay, what happens if I get ill and I can't pay my mortgage or I can't pay my rent? Say you're living with a partner, would you make sure their name is on a rent book just in case something happened? Or what would happen, if you lose your job? That's starting to plan for things. But also, I do think a diagnosis of a life-limiting condition should prompt a conversation, because actually some diseases have quite clear trajectory is a very medical word, but a journey, an expectation. But sometimes clinicians are a bit worried about talking about that. They're worried about frightening people. But most people do know what's going to happen. But if the person looking after them doesn't give them permission to start talking, sometimes people don't think into the future. But actually, a lot of illnesses are quite predictable. If I think about this from a doctor's perspective, so everybody I look after has a life-limiting disease. I'm a palliative care doctor. And what I see in families who struggle to talk about what's really happening is there's lots of fear. There's lots of unsaid conversations. So there'll be more panic, more stress, maybe an unplanned and unwanted hospital admission because somebody else in the family doesn't know what other people in the family know. So say someone really wants to die at home, somebody comes to the house and says, well, you've got to call an ambulance. And then before you know it, somebody is in an ambulance, maybe dies in the ambulance. But I also see very sad financial concerns with maybe although I go for people's health, often people tell me that they've got no idea how they're going to find money for a funeral. They didn't know what somebody would have wanted, maybe for their funeral, but also maybe for other things like looking after children. And with young families, children who don't know what's happening when someone in their family is ill and someone dies, their bereavement outcomes are much worse. And we all want our children to do well. My family are kind of used to it, and I think the people I work with are. The reality is we all die, and actually saying it's creepy, it's just part of life's journey, really. And mostly when we talk about dying, we're talking about how you live well until you die, not actually about the dying bit, but it's the bits that make it easier, and that's why we talk about it. And a lot of people are fearful of palliative care. I have medical colleagues who are very concerned about referring patients to us. It's almost like we're the cause of the dying rather than actually we're being referred because sometimes we see people who might be living for years but have got difficult control symptoms. And generally my patients sometimes and their families can be quite anxious about us coming to talk about, because we talk about their symptoms, but we also will talk about the future. And generally when we finish, they're very happy to see us because they've been able to have an open conversation, but only to where they want to go. But most people want to talk about their future. It's not just because you're ill, you shouldn't be not able to. I think we should talk about assisted dying because it's in the public consciousness, and there's a feeling that maybe people are being deprived of something, but a lot of that comes down to people's fear of dying. When I have patients who ask me, because I'm often actually very pleased when someone asks me, because it means that they need to talk and they're scared. And generally, because very few of my patients want to die. Most people want to live as long as possible, but they want to live well. They want to live with less pain, with being able to do as much as possible. And I can't make people magically not have pain, not have any symptoms, but we can do an awful lot to support them living well. And actually, if someone says to me, I want to die sooner than I expected, then I think, oh gosh, right, now we can really get into what's worrying you. I think it depends on what stage in your life you're at, really. So for some people, maybe like I talked earlier about somebody who's buying a house, actually the person you need to talk to is a solicitor or someone who can help you write a will. And at that point, maybe you also might want to think about a lasting power of attorney. Again, someone who's got a legal, or you can do it yourself, but you have to make sure you do it right. That might be all you actually need to do at that point. But if you're going to do a lasting power of attorney, you need to actually make sure the person who you're giving that attorney to, in case you lose capacity, actually knows what you want. And that's the crucial thing, because you don't want them having attorney to make decisions and them not knowing the kind of decisions they were going to have to make. And then as you get older or things change in your life, then you might need to talk to your GP. You might need to talk to your specialist about your health problems, about what's likely to happen in the future, and the nurses who are looking after you about your worries and concerns. But you might also need to talk to a debt advisor. You might need to talk to somebody about how you plan your finances so that your family aren't left with, we have quite a lot of traditions in our community who like big funerals. They love a big funeral, a massive party when you die, but they're not cheap. And we spend a lot of our lives making sure our family are okay. But actually, if you leave them with a massive bill after you've died, that's something you can prepare for at any stage in your life. And that's not necessarily spending a lot of money on a plan for a funeral plan. That's saying I'm going to allocate some money and make a plan for it, which is different from necessarily paying someone for a funeral plan. But there's lots of choices, and it might be you want to talk to extended family. I spend a lot of time talking to neighbours, to people, you know. Oh, and I know I have an unusual job, but things come up, you know, and over coffee things come out. And if someone is bereaved recently, then we can talk to them about dying and their feelings. And that is the community. It's not just authority figures, and it's not just professionals. It'll be the person you're in your knitting club with, or the person who you go to a social club with, who maybe you've noticed that they're not coming with their partner anymore and need a cup of tea and a chat. It is very personal. I think the thing with it is to walk towards it. It's to invite it, and it's to welcome that conversation as part of life, not see it as something that is a separate thing. And getting yourself a little knowledge about your choices can really help inform you, or finding people who can help. But yeah, I do think there is not a right or wrong time, and actually it can be an amazing conversation.